Welcome to the Brand Icon of the Year Awards 2021. This program showcases entrepreneurs and professionals from the MSME sector for their contributions to the Indian economy and business ecosystem. Plugin PR presents Brand Icon of the Year Awards to Dr. Shailendra Pratap Singh, Senior Consultant and Orthopedic Surgeon of S.S.B Hospital.
Thanks for having me over here. Thank you very much.
Let's start by understanding, a bit about yourself.
Actually, I am practicing orthopedics and joint replacement surgeon here in S.S.B Hospital, Faridabad. And I have been in this city since last 10 years. I started at Fortis Hospital, Faridabad. I have worked in Metro Hospital, Faridabad, as well as Sarvodaya Hospital, Faridabad. I am serving the community of Faridabad since last 10 years, and I'm quite happy about it.
Dr. Shailendra, one of the things that during this pandemic time we are witnessing is pretty much every other specialization, barring pulmonologists, people working in the frontline warriors who are treating COVID patients. Pretty much every other specialization currently is on the sidelines. How much has this impacted your line of expertise?
As the number of patients is increasing, and if it continues to increase at this speed, at some point of time, we will have to directly see and treat corona patients under the guidelines of physicians and pulmonologists, of course. And the second thing is this, that right now, the people who are suffering from severe disease are in the hospital, of course, and they require hospitalization. Those people who are quarantined or those who cannot go out because of lockdown and those who are not going to work are still suffering major problems because of the inactivity right now. I guess, and see the elective surgeries, elective procedures, we of course are not doing. We are doing only emergency surgeries, emergency procedures, which is of course essential. Other than that, we have postponed all the elective surgeries because of COVID.
But Dr. Shailendra, also it is seen during this pandemic time. In fact, one of the things that has happened to the healthcare segment is that the digitalization of treatment. People going online using apps for consultation. Are you also taking providing consulting to your patients through online?
Yeah, we are doing online consultations. We are doing video consultations as much as we can, but sometimes it's essential to examine the patient and see the patient. And if it's not an emergency, we would like to treat the patient online so that patients are not exposed to the virus by going outside. But if it's essential, then it's a different thing. Otherwise, online consultations are okay.
And doctor, once this dust settles down, hoping probably this year or next year, the pandemic, do you think the medical fraternity and the healthcare sector as such will start using, online consulting, and even patients, would they be open to using this instead of coming all the way to the hospital or a doctor, and how much time goes into it? So you think online consultation, video consulting is here to stay?
See, for small problems, what I personally feel is for small problems, it is okay. But it's important to examine the patient physically before coming to a conclusion or decision. So we need to see the patient. That is important. Yes, we can halt patient visiting the hospital for a short period of time, but it's essential to examine the patient before we start the treatment.
My personal opinion is the follow-up could actually switch to online, because right now I myself am doing online using online consulting with my doctor. So I think to a large part the online consulting might actually move on to online.
Yeah, follow-ups we can do. That's not a problem. If there is any problem arises, we need to see the patient, then it is a different thing. Otherwise, in follow-up patients, we can do video consultations, online consultations.
Now coming to your specialization, how many surgeries or cases have you done so far, and which was the most complex one that you did?
I might have done, I guess, 5,000, 6,000 cases. So actually, we replaced both knees and both hips of a patient who was suffering from rheumatoid arthritis, and she was on bed since last 2 years, and she was able to move without any help, without any walker, without any support after 2 years. And for 2 years, she was completely bettered, and she wasn't able to move on her own. So that gives immense satisfaction as a doctor, as a surgeon also. And there was one patient who was having a non-union. His bone was not uniting, leg bone, tibia, and who was operated 11 times earlier. So I operated upon him, and that also took a bit time, 4 5 months. But his bone got united, and he was finally able to walk on his own.
So, you are in Faridabad, where when you compare with metro cities like Delhi, Mumbai, Hyderabad, it's different. The challenges, our current COVID time, we are seeing how there is shortage of oxygen, there's shortage of many things, and even they're there may not be enough super specialists in these areas. How do you see this whole scenario of healthcare sector? What needs to be done to bring up, especially bring up tier 2, tier 3 cities at least at par with metros?
Faridabad is at par with metros as far as treatment is concerned. The only thing is that we have less number of big hospitals. Other than that, the hospitals that we have in Faridabad are good enough. We can compare it with metros. There's no problem. There is no shortage of specialists or super specialists. Talking specifically about COVID times and shortage of oxygen, it is everywhere, not just in Faridabad. So that is it. We just need more number of hospitals and which are coming up.
Plugin PR presents Virtual Brand Icon for the Year 2021 awards to Dr. Shailendra Pratap Singh, Senior Consultant and Orthopedic Surgeon of S.S.B Hospital.
I am extremely happy and extremely thankful for recognizing what we are doing here. We are doing good work, and if we get something in appreciation, of course, it makes us very happy, and I'm really thankful for that.
Thank you, doctor. Thank you for joining in. We look forward to having you on our other health shows. Thank you.